I'm Maria Davila. I'm a third-year internal medicine resident at Rush University Medical Center. Applied to GI this semester, and so very excited for that. Along with my mentor, Dr. Rowe, we have worked a lot on primary biliary cholangitis, and we are super excited to share our recent abstract that's going to be presented this Monday. So we really wanted to see diagnostic delay at Rush University Medical Center regarding PBC. And so what we did was a retrospective review of 163 patients with AMA-positive PBC, just to see, how long it took to diagnose this PBC. And so as we know, quick review, PBC is an autoimmune cholestatic liver disease that destructs intrahepatic bile ducts. And it is usually presented in females over the age of 40 years old and can be associated with alkaline phosphatase levels that are high and also high titers of anti-mitochondrial antibodies, or AMA. After we did this retrospective review, we saw that in average, from first initial symptom onset or first initial elevation in alkaline phosphatase in these patients, it took on average 3 years for them to be diagnosed. And so we really wanted to see a little bit more about that. So we created a point system that would assign 1 point each to female sex, 1 point to age over the years of 40 years old, 1 point to presence of pruritus or itchiness, and a point each to alkaline phosphatase over the range of 120, and an extra point if alkaline phosphatase was over 250. And so we can probably expect that if patients had like 5 points, pretty obvious in your face diagnosis, the average related diagnosis was 100 days. But when we take into consideration these patients that had 2 to 3 points, the average related diagnosis was 2 years. And so this is the target population that we really wanted to see and help, because PBC can lead to cirrhosis with the need for transplantation. And so we can really improve outcomes by targeting this population. We took it one step further, and we took all patients at Rush, females over the age of 40, with 2 distinct alkaline phosphatases at Rush, and we saw that from 12,000 patients, only 12.4% had AMA testing, and only 9% had hepatology referral orders. Now we know that this elevation in ALK phos is not usually always due to liver disease, but it may. And so what we are trying to do now in the future is try to do as much medical education as possible to raise awareness, not only in hepatology and GI, in the GI world, but also with PCPs, rheumatologists, dermatologists with presence of itchiness. And so maybe, once we do all this medical education at Rush, we can really raise awareness, and improve outcomes for PBC.